Welcome to Spine School. My name's Fiona. I'm one of the Spinal Advanced Nurse Practitioner team, and this presentation is to guide you through enhanced recovery after your spinal surgery. Spinal surgery places your body under a lot of stress, and our goal of the Enhanced Recovery Programme is to help reduce some of this stress to improve your recovery. Our aim is to support and guide you and your family as you prepare, undergo and recover from your spinal surgery. It's important to understand that we want you to play an active role and be involved in your care, as this is a vital part of your recovery process. Enhanced recovery helps prepare you for surgery, understand what you can do to improve your health and fitness before your operation, what to expect when you actually come into hospital, and how to continue your recovery at home. This video can be viewed online before, during and after your surgery. You will receive a telephone consultation to answer any questions you may have before your admission to hospital. Thank you for watching. Before your surgery, you will have a pre-operative assessment appointment to determine if you are physically fit enough to have surgery and an anaesthetic. During the appointment, you'll be asked about your general health, fitness, previous operations and illnesses, and your home circumstances. During your physical examination, you may need to partially undress and lie down on an examination couch. The examination will be performed by the nurse practitioner who will listen to your heart and lungs. An ECG will be performed which records the rate, rhythm and the electrical activity of your heart. It does not cause any discomfort, however please note that you will need to partially undress for this test. You will also have some routine blood and swab tests taken. During your pre-assessment, you'll be given an antibacterial wash called Hibiscrub to use before your surgery. This wash helps minimise infection and you'll be told how and when to use it. This appointment is important as we are aiming to ensure you are in the best possible condition before your surgery. Before your surgery, we want to help you to optimise any pre-existing health conditions, for example hypertension, diabetes or anemia. If these are not well controlled with medication and monitoring, then it may affect your surgery and recovery time. Please seek your GP support in managing your conditions. Please try to have a dental checkup routinely before your surgery to identify and treat any underlying dental caries, as this can cause infection and complicate your recovery. Having surgery puts a lot of strain on your body. Aim to get yourself in the best physical condition. If you are able to do some physical activity within your pain limits, try a gentle walk each day and keep your muscles active. This will improve both your physical health and your psychological well-being. In order for you to be in the best physical health, we recommend that you stop or reduce your smoking and drinking alcohol. Smoking affects wound and bone healing and can increase the risk of infections, and alcohol can suppress the immune system. Ideally, we would recommend that you make this change before you come in for your operation. However, we do have a smoking cessation and alcohol advice service who can support you if needed once in hospital. Please contact one of the NHS links on the slide for professional support and advice. Good nutrition in the days and weeks before your surgery, as well as afterwards, will optimise your health and help you recover more quickly. Your meals should include protein, which is essential for growth and repair of your body. Carbohydrate, which is the main energy source for your body to promote healing after surgery. and fruit and vegetables are good sources of vitamins and minerals to help your body defend itself and help the immune system. By eating as well as you can, your body will have the nutrients to rebuild damaged tissue, fight infection, and cope with any side effects of your surgery.
My name's Lisa Herod. I'm the lead spinal physiotherapist on F4 Spinal Ward. Before you come into hospital, it's helpful to think about what happens once you get home after your spinal surgery. By planning early, and especially before you come into hospital, we can help to identify any support that you might need when you leave. If you feel that you're likely to experience any difficulties, then you have a community therapy team or social services teams that might be able to help you. Please discuss this with the ward staff at pre-assessment. Some questions to think about is if you need support at home, do you need any additional help? Do you have someone that could come and stay with you on discharge? And do you have someone that could help out with some shopping or cleaning or lifting or any other daily tasks that you might feel that you struggle with? If you do have somebody at home with you that can help with shopping, then it might be worth thinking about stocking the freezer up, because once you are home, you might not feel like you need to do a big meal and do any meal prep. You might find it difficult to do some personal hygiene and think about your bathroom, if you have a bath or a shower, or whether you need to set up a chair to perhaps strip wash for the first few days. If you're staying with somebody else on discharge, you need to make sure you have the correct GP cover, which might mean to register temporarily with a different GP initially. It's often a good idea before you come into hospital to think about your daily routine and things you might struggle with. For example, I'd like you to think about from the moment you wake up and get out of bed to the moment you go back into bed at the end of the day, if there's anything that you particularly find difficult at this stage. In the kitchen, you might want to think about bringing down heavy bowls and putting them into a place that's more accessible. Likewise, if you're having back surgery, anything that's in low drawers that you normally have to bend to, putting them up on the side so they're easier to get to. After your surgery, if you're having neck surgery, you want to avoid looking up too much or looking down too much or putting your neck into a difficult position. So again, taking heavy things such as teapots or saucepans or anything that you might need out of the kitchen and putting them so that you don't have to move too much. Again, to think about post-operatively after you've had your neck surgery, even simple things such as picking up a kettle can be quite difficult. If you pick it up and it's too heavy, what we'd ask you to do is just empty the water out so there's about a cup full in there, and that should reduce any pressure on your neck. And again, when we're cooking and thinking about meal prep, it is useful to have some microwave meals at home so that you don't have to stand and do a lot of prep. And it's easier at the end of the day, if you're slightly tired, to just pick up something from the fridge, pop it in the microwave, and then it's all done for you. Even simple things like where you keep your loo roll can make a massive difference when it comes to making life easier for you after your operation. For example, if you normally keep it down low, you're going to end up flexing too much. Likewise, if you keep it behind you, you're going to have to turn too much. So keeping it somewhere nice and simple is going to make life better.
As there is limited storage space in the wards, please bring essential items only. Your belongings should be able to fit into a small cabin-sized case or bag. Please bring all your normal medication in its original packaging so that our pharmacy team can complete necessary safety checks. Please do ensure you have an adequate supply of your usual medication at home, and we recommend 28 days. Please do not stop taking your medication, including on the day of your operation, unless you have been advised to do so by your consultant or one of the pre-assessment team. If you are taking herbal or homeopathic remedies, then please make sure you discuss this at your pre-assessment appointment before surgery, as some of these may need to be stopped for safety reasons. In terms of clothing, please be aware that the hospital environment is usually very warm and layers of lightweight clothing are often more suitable. Please bring sensible, non-slip footwear and slippers with backs on them. You will be encouraged to wear your own clothing. Please do not bring large amounts of valuables or jewellery. You'll be able to wear wedding rings. You are able to use a mobile phone or an iPad, but please be sensitive to and respect those around you. There is a free Wi-Fi access for patient access, and please ask staff for login details once you are here. We aim to avoid long periods of fasting, and you should continue to eat and drink normally until the night before your surgery. Please follow the fasting instructions. Patients who do not have diabetes will be given 2 cartons of carbohydrate pre-op drink to consume on the morning of their surgery. Your body burns a lot of energy during and after surgery and uses up stored carbohydrate. These carbohydrate drinks have been designed to help the body stores from becoming depleted, which can decrease your strength and delay recovery. The pre-op drink is a non-carbonated, lemon-flavoured carbohydrate drink. It has been shown to prevent a rise in blood sugar levels, to minimise protein loss from muscle breakdown and depleted stores, and improve patient comfort by reducing thirst and hunger. Unfortunately, these carbohydrate drinks are not suitable for our diabetic patients. We understand that coming into hospital for your surgery can be stressful. We will provide you with information that hopefully will make you feel less anxious and more prepared. On the arrival on the day of your surgery, you will have received a letter detailing the admission area you need to go to and the time you are expected. Admission times are normally early or late morning, but please be aware you may not go to theatre until later in that day. We will aim to give you an idea of when your surgery is expected. Unfortunately, there can be some waiting around, so please bring something to read, such as a book, your iPad or tablet. Once you arrive, a member of staff will complete your admission documentation and you will see the consultant anaesthetist. This is a good time to ask any outstanding questions you may have, and we would suggest you write them down so you don't forget. Please be aware that you may be asked a number of questions on different occasions. This is all part of the surgical checklist and is an important safety check to ensure treatment and your information is correct. When the teams are ready, you'll be asked to go to theatre. After your surgery, you'll be encouraged to start drinking and eating as soon as possible, and IV fluids will be stopped as they are no longer required. You should try to drink at least 2 litres of fluid a day. Good nutrition can lower your risk of infection and increase your energy and strength. Post-operative pain is normal after surgery and does not mean there is any new damage. The type of medication you have depends on the type of surgery. If you have an epidural or intravenous pain relief, such as a PCA, then this may be changed to oral pain relief as required. Please ask for regular pain relief, as this allows you to fully participate in therapy and will speed up your recovery. It is not unusual to experience different pain in the post-operative recovery phase. Some neuropathic or nerve pain may not fully recover as the damage had been done already. It can take several weeks and months for pain to fully resolve, but this will be reviewed at your follow-up appointment. If you have drips and drains after your surgery, these will be removed as soon as possible to reduce the risk of infection. If you have a catheter after your surgery, once this is removed, you'll be encouraged to mobilise to the bathroom. An important part of spinal surgery is ensuring that your bladder and bowel are working normally, and you may be given some laxatives to help with this and asked about your bladder and bowel function. Anti-embolic stockings and pneumatic pumps are used around your calves to promote good circulation until you are able to mobilise independently. You may be required to have anticoagulant medication if you are not fully mobilising. You will be encouraged to mobilise on the day of surgery itself or the morning after, depending on the timing of your operation and the type of surgery you have undergone. The nursing team or one of the therapy team can initially help you get out of bed, and we recommend that you make sure you've had your pain relief. By mobilising early after your surgery, your chances of having complications such as a chest infection or a blood clot are reduced. Gently moving helps restore muscle strength and improve circulation. Mobilising around the ward area increases your fitness and confidence, and overall will reduce your time in hospital. You'll be taught how to get in and out of bed, and you will be encouraged to get dressed in your own clothes on the day after surgery. You'll be encouraged to initially sit in your chair for short periods of 5 to 15 minutes whilst you have your meals and drinks, and then get up and walk around, returning to your chair or having a lie down. You will be encouraged to very regularly change the position to offload the pressure in your back whilst you're recovering. There is no particular position you need to sleep in, but we recommend you choose a bed that supports the length of your spine. You'll be reviewed by the on-call consultant and spinal team every day of your hospital admission, and this usually takes place first thing in the morning. It is helpful to think about your discharge as early as possible. The decision for you to go home will be made by the team based on several goals. Is your pain relief adequate to allow you to mobilise safely? Are you eating and drinking normally? Is your bladder and bowel working normally? Is your wound healing as expected? Do you need an X-ray before going home? If you have any instrumentation, that is metalwork, from the surgery, then this is checked with an X-ray before you leave hospital. Once these goals have been achieved, then your discharge paperwork will be completed and any medication you require obtained from pharmacy. You will be given a time frame for someone to come and collect you from hospital. Getting in and out of a car is not always easy the first few days after surgery, but here are some pointers for trying to help the process. We recommend you adjust the position of the car seat, and a small cushion in your back may help. You can place a plastic bag on the seat of the chair to enable you to swivel your legs into the footwell. If you know your journey is going to be more than 30 minutes, we recommend that you interrupt this journey and get out of the car and walk for a few minutes before continuing. After your spinal surgery, once you have been discharged, we recommend you try and keep your wound as dry as possible for the first 7 to 10 days to allow healing. You need to continue to mobilise as the physiotherapy team have guided you. You will receive a telephone follow-up from the enhanced recovery team. You'll be expected to attend your spinal follow-up as directed on your discharge documents, and you will receive an appointment for this. And please complete the British Spine Registry questionnaires that you will be sent before and after your surgery to help us progress care in the future.
How long do I have to wear my anti-embolic stockings for?
Your stockings will be given to you before your surgery. We will give you 2 pairs to have to go home. You can take your stockings off to shower, but we would really encourage you to wear them at all other times for about 2 to 4 weeks after your operation until your mobility improves.
What do I do if I have problems opening my bowels after surgery?
It can sometimes take a few days for your bowels to start moving after an operation, as you're not as mobile as usual and you may be having strong pain relief. We would recommend you seek advice from your local pharmacist and GP for stronger laxatives. Make sure you're drinking plenty of fluids and eating a well-balanced diet. If you feel unwell or are vomiting, please seek your GP for advice.
How do I look after my wound?
Your wound will be checked before you leave the hospital and are discharged home. The closure on your wound will depend on your surgeon. You may have absorbable sutures or skin glue, which will gradually dissolve with time. You may have removable sutures or clips, which will be taken out at your GP practice, and you'll be given a letter for this. You need to be careful and avoid getting your wound too wet in the early healing process, around 10 to 14 days. Most dressings are splash proof, but if water gets underneath, your dressing will need to be changed. If you have any signs of infection, such as redness, leakage, pain, or swelling, please contact the spinal unit with the number you've been given.
What do I do if I need more pain relief?
Please take your regular pain relief medication supplied to you on discharge. If you're experiencing some pain, please contact your GP. They will be aware of the medication you have received and will be able to discuss some replacement or additional medication. If you're experiencing new pain or significantly increased pain, then please contact your GP directly. And if severe, please attend your local emergency department.
When can I drive?
You cannot drive until you can sit comfortably, move your head freely, and feel confident about performing an emergency stop. This may be around 2 to 4 weeks if you've had cervical surgery, or a bit longer, 4 to 8 weeks if you've had lumbar surgery. If you have any altered sensation or weakness in your limbs, you should not be driving. Initially, you should avoid long car journeys. You may need to check with your insurance company that you are covered to drive after your surgery.
When can I go back to work?
The timing of returning to work depends on the type of job and your recovery. Most people are off work for an initial 4 weeks, but if you have a strenuous job, you may need a longer period of around 6 to 8 weeks. We would recommend that you discuss this with your employer, and you may need to return on light duties or reduced hours at first. If required, please request a fitness to work certificate before you leave hospital. And if this needs to be extended, then you can discuss this with your GP.
Hello, my name is Teresa. I'm one of the other Spinal Advanced Nurse practitioners. Thank you for taking the time to watch this video about enhanced recovery. We hope that we've answered some of your questions and helped you prepare for your surgery. We look forward to meeting you shortly. Please contact us if we can help you any further. We will be telephoning you, so maybe have some questions ready that we can answer when we call you to go through the video.